Corporate Insight provides competitive intelligence research and customer experience analysis to the nation's leading financial and healthcare organizations. So today I'll share with you some of the key digital trends that we're seeing in the health insurance space and how it points to the future of greater consumer empowerment, convenience, and personalization. Let's see if this will work. Okay. We recently conducted research analyzing the frequency of site changes made on the public websites and member websites of 21 major health insurers. We tracked this data across a 12-month period and placed this data into one of eight categories, which you can see on the left side: login security, plan servicing. And then we assigned significance ratings based on the size or the impact that that change has on the customer experience. And that's rated with a high, medium, or low score. And you can see those buckets on the right and some of those common types of changes we saw. So when we looked at the data, insurers collectively made over 570 updates to their websites. These changes included adding additions in terms of features and functionality, as well as updating existing digital capabilities. When we look at that number in comparison to previous cycles, it is slightly lower. Last year, we saw around 600 total changes, but again, that can be attested to COVID-19. When we look outside of the industry, this number is actually on par or slightly above the number we see from financial service firms, as well as other insurance type of firms. So while we like to think of the health insurance as a laggard in terms of digital innovation, they're actually keeping pace in terms of that digital enhancements. On average, firms made 26.2 changes on their public and member websites. And then looking at the total number of changes, 48% of that was of high or medium significance. So firms are clearly making significant additions or enhancements to their properties to match consumers' needs. And so this pace just clearly indicates that insurers are recognizing the importance of these digital properties and the need to have those regular website updates to keep up with consumer needs. So here's a breakdown of those total changes and significance by firm. And in the past year, you can see that the big players on the left really went through some significant transformation. United Healthcare sits at top as the most active firm with 62 total changes, followed by Kaiser Permanente with 54 and Aetna with 49. And these three did remain the same from our previous cycle. It's just KP topped Aetna for that second spot. So clearly they understand to maintain that competitive edge that they need to invest in that digital strategy. We also see that Aetna had the highest proportion of changes, high significance changes to total changes, which equated to 27%. Aetna rolled out passwordless login, a new care and cost tool, as well as a transgender support center, which housed resources for mental, physical, and emotional well-being. So again, these competitors know how to stay ahead of their competition, not just in the sheer volume of changes, but also that proportion of changes, and that has the major or most impact on the user. So here's how the changes broke down by category. You can see that alerts, education, information had the most changes, followed by tools and digital resources second. So collectively, those two consisted of more than half of the total changes. So firms are doing a good job in terms of those timely and proactive alerts, robust educational resources to notify users about changes in their plan or events such as COVID-19 or enrollment periods. While design and navigation consisted of only 15% of the total changes, we did report several full site revamps. Here's an example of one of the best example of a high significance update that we saw. So BCBS of Minnesota overhauled its member site and converted it into the Castlight Health platform, so incorporating gamification and community elements. And this was pretty revolutionary in that it was the first insurer that we saw to completely transform to this navigator type of platform. So they're not only promoting insurance, but they're also incorporating overall health and well-being as well. The homepage prominently promotes the rewards balance, ongoing challenges, as well as personalized health recommendations. Members can also connect their health trackers, as well as track and sync their physical metrics as well. So while I mentioned earlier that the number did slightly decline from the previous cycle, you can see that a large portion of that falls into that alerts category in that top orange bar there. And again, we can attest that to COVID responses there. In terms of other categories, 5 of those have roughly the same amount of changes year over year, but we did see an uptick in terms of 2 categories that had an increase from the previous cycle. And we'll start with coverage and account details. They totaled 40 changes, and some of those notable changes were new spending summary trackers, expanded behavioral health benefits, and additional options for EOBs, prior authorizations, and claim submissions. Firms more than doubled their plan servicing changes. One of the most notable options was the addition of those demographic questions. So users can input questions about their sex, sexual orientation, gender, race, ethnicity. And this gives the firms a clear picture of their members and then is able to provide that right care at the right time. Conversely, we also see the benefits from the member's perspective. So they're allowed to ensure that all aspects of their orientation or their identity is being understood and understood by their insurer. According to our 2023 consumer survey, 70% of respondents indicated that they log into their desktop health plan site at least once a month. So that frequency really implies that they're using these sites, and firms need to make sure that they're up to date in terms of care, communication, and plan information. While the member sites only consisted of 37% of total changes, 69% of high significant updates were behind the login. About a third of firms made over 10 changes to their websites. And then again, you can see those top most active firms sitting at the top, with Aetna with the most changes, followed by KP and United Healthcare. Coverage and account details and login and security updates were mostly found on the member site. Things like new additional authentication options, new information and resources around coordination of benefits, service usage, and prescription coverage. So here's the breakdown of changes by month. And you can see this upward trajectory, especially as we're getting into 2023, of firms implementing more changes each month. We did see a huge uptick in terms of April and May, with 78 and 80 changes collectively. Last year, these changes also correlate a lot with events, right, that are going on in the healthcare space. And you can see in the last year's cycle, around February, there's a huge spike there, and that's largely contributed to the reimbursement information and new coverage information around at-home testing kits. The end of the public health emergency played a significant role in that spike in April and May, with many firms notifying users of that impact to them through homepage alerts and new pages. BCBS in Massachusetts added information about coverage changes to testing and reimbursements. IBX updated their COVID-19 public page to notify them about what's going to happen with their benefits and how they're going to tackle things like virtual visits, testing, and vaccines. So tools and digital resources accounted for about 1/5 the total changes and about 1/4 of high and medium significance changes. All firms made at least one change, and then we see Kaiser sitting at top making 12 total changes, followed by Anthem. Tools, obviously, there's a new wave of those virtual tools that there is a craving and an appetite by the consumers. And we saw these tool changes really fall into 3 buckets. So it was care and cost tools, quote tools, and chatbots. In terms of care and cost tools, we saw more than half of our coverage firms implement third-party powered tools on their public sites and on their member sites. Firms are now leaning in and partnering with these best-in-class vendors to build these key resources. So here are some of the most notable examples. We have Harvard Pilgrim that rolled out a Rally Power tool, which is exclusively designed for behavioral health care. So members can search for a provider as well as get a service cost based on facility, condition, and treatments. IBX now uses the HealthSpark Power tool for the provider locator, easily allowing users to search for in-network doctors, compare, read and write reviews as well. And then we also saw other insurers too, such as Aetna and UPMC, also implement HealthSpark tools in this cycle. And then Humana and Select Health introduced a Change Healthcare cost estimator. So the tool allows users to get a price range for a treatment, get an estimated total cost, understand what the amount the plan will pay, and the amount that is going to be owed by the member. We also saw many firms implement this robust health Sherpa power tool, and it's an integrated quote and recommendation tool. These recommendations are based on the user's lifestyle and plan usage. They can also input information about their preferred providers and their current medications to ensure that all the results are going to actually match their needs. We saw Oscar also introduce a Stride Health Quote tool with sleek design, easy navigation, and again, they're asking questions around lifestyle, usage, benefits to then generate plans that fit their needs. And then chatbots on the health insurance sites are becoming increasingly popular, and that can be largely attested to the rise of ChatGPT and other AI-powered tools. Notably, a quarter of firms updated or introduced chatbots to their websites. Many firms like Emblem Health integrated virtual assistant capabilities within their existing live chat tools. So now users can get questions easily without having to connect to an agent. Many firms also introduced these topic-specific or function-specific tools on their sites. So we see here that Anthem added a shopper assistant that's now integrated within their quote tools to guide them in those journeys. Kaiser Permanente added a pharmacy-specific one that allows users to ask questions in terms of medication, drug pricing, status, and refills. And then Florida Blue also integrated a virtual assistant live chat tool within their care and cost tool. So again, helping them choose the right provider or determine the right cost for them. And then most recently, we saw Oscar introduce this feature called AI at Oscar, and it's actually documenting all their AI experimentation. So some of the notable features they called out was this claim assistant, a client inquiry assistant, and this new documentation feature that summarizes conversations between patients and providers. So based on our data, we saw a wide range of informative trends, technologies, and approaches that are shaping the future of healthcare and bettering the customer experience. So when we want to look ahead, what's next in this space? We saw that over half the changes were made on the public site. Clearly, there needs to be investment made on the public site to reach consumers. Firms are also optimizing their SEOs and their clear calls to action to create frictionless shopping, to acquire and attain customers. Firms are doing a better job in terms of smoothing that shopping experience with online quote tools and plan recommendation tools. And firms need to do a better job in terms of personalizing those plan recommendations based on one's health profile and needs. They really should look to mirror that Netflix experience, right, where they customize or suggest shows based on their viewing history. We expect to see better transparency for one's plan and treatment options, specifically around services, quality metrics, and cost. Firms need to continue to push those care estimator tools to allow users to compare providers and performances across different providers as well. We did, according to our survey, see that 80% of consumers indicating the importance of knowing the price of a healthcare visit or of a treatment at the time of the service. So we expect to see more of these tools pop up and actually deliver more accurate, detailed results. There's a growing demand around digital solutions around care management and communication channels. Members want to be able to decide their providers, treatment plans, services that match their needs, preferences, and budget. We look for firms to create more robust provider locator tools to help guide them and make smarter decisions in terms of in-office visits or even virtual visits through appointment scheduling as well. We're also going to look for the consumerism that's happening outside the healthcare space to really drive change within our industry. It's really it's really shaping how consumers want to have service and how they want to manage their care. They want to be active participants in their care journeys, and firms need to do a better job of personalizing content, options, and those experiences based on the unique circumstances of that individual. They need to treat customers like informed consumers to enable loyalty and satisfaction and keep them as ongoing members. By enabling these digital enhancements, you are allowing users to become informed with their decisions, choosing their journeys, choosing their outcomes, which will set the stage for a more significant transformation in terms of what's going on in the industry.